welcome. Thanks for coming. The big impetus for this talk is to really understand everything non-orthopedic and non-medical that goes into sports. And until you've really been in a sports practice or spent a lot of time with youth athletes, you don't really understand like the big toll that it takes on the child and the families. And, as a sports surgeon sitting in my office every day, a lot of times I feel like a family therapist because I got moms and dads and guardians and kids, and there's often a lot of crying. There's often a lot of arguing back and forth. And I never really knew that kind of stuff went on until I was really providing care for these folks. So I always start off like with an example. So there was a kid, he's a 15-year-old, he's a football player, and you can see his medial epicondyle fracture of his elbow, and he went to an outside urgent care, which was outside of Philadelphia. And, he was seen and evaluated, but he never even got x-rays. They were like, oh my God, he's young. We're not even going to get x-rays. You need to go somewhere else. So he went to another urgent care. And at that urgent care, they got these x-rays. They saw he has a medial epicondyle fracture. They splinted him, and they sent him, as you can imagine, to the emergency room. He gets to the emergency room, and this is more of an adult emergency room. They're like, oh yeah, you do have a medial epicondyle fracture. It's unstable. You need urgent surgery. They kept him in the same splint that he was in from the urgent care. It was like, well, you need to go to our hospital. So of course he shows up to our hospital. It's by now like in the middle of the night, and this is a fracture, but it's by no means an emergency. We usually treat these things as an outpatient. So of course we sent him home. And you can imagine kind of along the way at every stop, he's, they're paying a copay, they're checking in, they're getting their vitals done. There's a lot of resources being utilized. There's physicians that are documenting along the way. Obviously, it's very costly and expensive. And actually, the trip from the ER number 1 to our emergency room was in an ambulance because they said his elbow was so unstable that they would not let him go in his own car. So that's several thousands of dollars right there. And this trip took probably about 9 hours or something like that. So when you think of youth sports, and that's a very egregious example, but when you think of what these athletes go through and all the things that kind of surround them getting care, we always usually just think of the things at the tip of the iceberg. So we think of the time that it takes to go to all those places, the money that it takes to go from doctor to doctor. We think of the resources. But what I've really noticed in my travels doing this is that there's so much more. So if you think about it, that kid was in a lot of pain, right? He had a big, huge elbow injury. He's getting jostled around between waiting rooms and exam rooms and getting in and out of his car, getting in and out of the ambulance. The expectations, right? So every single place, some different provider is telling him, oh my God, like you need this and you need surgery and your elbow will never be the same and blah, blah, blah. And of course, he and his mom are probably pretty afraid. There's a lot of anxiety. And there's a lot of myths, right? Like all that time mom was telling me, I met the parents, she was telling me that, she's texting her neighbors and she's Googling things and she's reading about medial epicondyle fractures. So she's getting like all worked up and everything. And she has a ton of questions. What is this going to do to my kid's elbow? What's going to happen on Monday when I have to go to work and he needs surgery and like all this stuff. But most importantly, there's the guilt, that we feel as parents, right? You don't want your kids to be hurt. You don't want them to have any issues or problems. So, and again, this is kind of a very extreme example, but the reason I bring this up because it's a big spectrum of how kids and parents navigate the world of an injury or pain or some problem as an athlete. And there's some permutation of all of these things that they experience and feel, even if they like roll their ankle and go see their PCP or go see me, there's some kind of combination of all these things. And these are the kind of things that we deal with in the office, and it kind of spurs on a lot of other issues that I'm going to kind of go with. And a lot of it does come from the different questions and the inappropriate expectations that parents have. So one of the big things that we start off talking about in youth sports is this idea of sports specialization, right? So expectations is rampant in people's minds. When should my kids specialize in their sport? When should they focus on a different sport? So we characterize early sports specialization as basically as year-round training when you're choosing one sport and you're basically quitting all other sports. And when we look at all the research that we do, there's like four main big things that we've realized with what's going on. So number one, specializing in a sport doesn't necessarily make you a pro. So when you survey a lot of professional athletes, most of them played lots of different sports growing up. The other thing is that it actually decreases your athleticism because when you play multiple sports, you're utilizing a lot of different body parts and muscles. If you're a football player and a wrestler and a basketball player, you're bringing different pieces of the puzzle to the table. And when you focus on one thing, you don't have that. Secondly, it becomes a mental issue, right? So if you focus on one thing when you're 9 years old and you do it, 12 months out of the year, it becomes like a big burden on you. There's a lot of stress associated with it, trying to live up to people's expectations from coaches and parents. And then last but not least, it also increases your injury risk because those certain body parts, they don't ever get a rest because you're utilizing it all the time. So when we talk about sports specialization, we kind of go in a clockwise fashion and we say, we want you to play it on one team at a time. It's so common, especially for things like baseball and softball. People play on multiple teams. They're guesting on different teams. So if you can, we want you to do one team at a time. We want you to figure out how you can delay that specialization, right? So we kind of rule of thumb, we talk about kids not really specialize until they're like in high school, probably 10th or 11th grade. But now you find kids who are like 3rd, 4th, and 5th grade, and they play literally just one sport. We talk about no more hours per week than the age and year. So if you're like 12, you probably shouldn't play your sport more than 12 hours a week. But depending on the sport, certain things like swimming and gymnastics, like people are doing it hours and hours and hours a week, like dance and figure skating. We talk about days of rest. I would say maybe even up to 3 days of rest a week. A lot of kids are playing 5, 6, 7 days a week. We want to make sure kids have appropriate recovery time at the end of a particular season. So people do one season of like travel ball, and then they go right into like little league ball, and then they go right into school ball after that. And this goes into the whole year-round thing. So we don't want kids really playing more than 8 months out of the year in the same sport. If they have to play sports year-round, those other 4 months, they should probably play something different, right? And this is like a nice rule of thumb. This came from a lot of the work and research that's done at a lot of our national sports medicine societies. So when we talk about expectations as well, these are some of the statistics that you can see. It's kind of a busy slide, but basically one of the things that you want to realize is that it says 94% of kids did not make it to the NCAA level that played high school sports. So that's 94%. That's kind of a lot, and your average kid playing in high school may think they may have a chance, but most of the time they don't. And when you specifically look at, the types, it goes 5 to 6% of high school athletes play in the NCAA. Then they break it down by, males and females. They also break it down by the different divisions. But those are the big things that I try to impress upon people is that any division of playing any kind of sport is probably around 5% of high school athletes will make it to that level. This is another thing that we display. So again, it's a kind of a busy slide. You can see all the different things about sports and it's the different levels. So there's probably about 5 or 6 different sports there. And the top number is high school, then NCAA draft eligible. So basically the biggest thing is that 0.04% of high school athletes eventually make it to the pros. And that's something that I try to tell people, when they're kind of freaking out about their, 9 or 10-year-old who's missing like 2 days of soccer. I'm like, well, by the time they get to high school, they're probably never going to amount to much anyway. They don't like to hear that, but, it is the truth. Unstructured free play. So this is something, when you grew up in the 80s and 90s, like we did, you come home from school and you go play in the backyard or in the street or it's at school or whatever you do. And, that's really, really important because the kids are learning socialization, they're learning rules, they're learning competition. I mean, think of all the backyard fights and arguments you've had playing these random games, and this person cheated and that person cheated. But you know what? By the end of the night, it's all been resolved. There may have been maybe some punches thrown and rocks thrown, but at some point you resolve it, you dealt with it. There are no adults around, and you all just sort it out, and you go about your business. And in the process, you're getting exercise and you're having fun and you're learning new skills. And unfortunately, a lot of that is disappearing, because most things are organized as we all know. And there's so many benefits too unstructured free play. This is something out of the pediatric literature, but it definitely spurs fun and creativity, social health and teamwork, mental and emotional health, builds resiliency and risk management skills. It definitely helps with learning and attention at school. That's why when your young ones go to school, they go out for recess in the middle of the day. That didn't just come from anywhere. It's because we know that the kids do need that little break during the day. And obviously it helps with physical health and gross motor skills. So one of the big things I get asked a lot is like, well, is it okay for my child to play through pain? So this is like a big thing. It'll be like a Thursday in the clinic. They'll come and see me. Their kid is having pain. They're having trouble walking around. They're limping around at practice, and they want to know what to do. And I tell them that they should rest and they should stop playing. But then they have this huge tournament on Saturday, 2 days from now. Can they play? That's always like the last question they ask me. Can they play? Right? Like you took off of work. You brought your kid out of school. You came to see me. And I'm telling you what you should do. And they're like, okay, that's great. Can I play in 2 days? That's what they always say. So the younger you are, the better off you probably are playing through pain. The older you are, it's more serious injuries. But, 8, 9-year-olds, a lot of times they do play with pain. And it's not always a huge deal. Most of the pain is just from overuse. It's not usually from big cartilage injuries or ligament injuries where they need surgery or anything like that. We always tell people to just make sure the performance is not affected. If you're still able to play, you're still able to run around, you're not like really hobbling around out there, it's probably okay. You definitely want to look for physical signs. So if there's a lot of bruising and redness and swelling, then you probably shouldn't be playing. Most of the time it does resolve with rest, but if it doesn't, and you're really concerned, you should definitely get evaluated earlier rather than later. Another thing a lot of people talk to me about is cross training. So, there's CrossFit, obviously, and there's all these pediatric cross training, CrossFit groups and clubs and gyms who will take your money if you will bring your kids there. And there's a lot of questions about that. And, I like to tell people it should be tailored to the individual child, right? So I don't know if you've ever done CrossFit, but you'll have 15 or 20 adults all line up and all do the same thing, and they're racing and competing and all that sort of stuff, which is fine. But with kids, it should be more about what they can do, what their limits are. It should be more focused on just like body weight stuff like push-ups and sit-ups and pull-ups and, core work. And the goal is really to think about the child and what they can do and what they can personally accomplish. Not so much about beating their neighbor or beating the guy or girl down the hall, but themselves. And unfortunately with CrossFit, competition is huge. I don't know if you guys know this, but right now it's like the National CrossFit Games in Madison, Wisconsin. It's like all this week, and it's like a huge deal. There's all these people competing. With kids, we really shouldn't focus on that. It should just really be about them doing it, their personal goals, their personal achievement, as opposed to like really competing with other people. Baseball and softball is a huge topic because people do it so much because it's not as rigorous, as a lot of other sports. You can play 8 games in a weekend tournament. And we get a lot of questions about pitching and pitch counts. And ideally, you want to minimize the pitch count. So you get these like 9-year-olds who are throwing breaking pitches and curveballs and all sorts of stuff. And that example I showed you, that's like a big example of somebody breaking their medial epicondyle. But you get a lot of kids with like, little leaguer's elbow and pitching elbow and that sort of stuff. And that's where it comes from. Really just like a lot of volume. Kids often have very poor form, right? Because they don't know how to throw appropriately. If they want to throw harder, they really just kind of whip their arm as opposed to using their legs and their core and their back muscles. And then maintaining appropriate strength and flexibility is something as kids don't always do. And that's when we lean on our physical therapy colleagues to help us out with that. Playing pitcher and catcher in the same game is a big no-no. A lot of kids, they adhere to the pitch count and they leave and then they just play catcher, or they play something like shortstop where they're throwing the ball all the time. That doesn't make any sense, right? And I always tell people, even though you're not a professional athlete, you should kind of think of yourself as one. So you would never see a professional baseball player come out of a game as a pitcher and then go back in another position. It would just never happen, and they would never play like multiple games in a weekend. They pitch once and they pitch again in like the starters anyway, like in a few days they have a rotation. Whereas with a lot of kids, especially in softball, they use the same pitcher over and over and over again, like a whole weekend in a bunch of games. And that's just not ideal. And then lastly, we really want to kind of think of off-speed pitches and curves as something that kids do later. As they get older, they get more strength, they get more motor control, and that sort of thing. So, the first half of all these slides was really to focus more on the like physical aspect and the orthopedic aspect. I want to switch gears and talk more about like kind of the mental and emotional and psychological issues. And this is something as an orthopedic surgeon I was never really trained on per se, but I've learned over the years. So there's a lot of challenges that our kids face. Obviously, there's the sacrifice aspect. You know, if they're out playing their sport however many hours a week, they're not doing other things, right? They're not spending time with their family. They're not sleeping. They're not resting. They're not playing with their dog. They're not doing whatever they like to do. There's obviously the pressure, whether or not they can leave the sport. Obviously, they can get hurt. And for parents, the financial aspect, as you know, none of the travel sports are free. All the tournaments, all the league fees, all the swag you have to buy at the tournaments, all the apparel and the bats and the balls and the gloves. There's a lot of adults out there making a ton of money off of our kids playing sports. And unfortunately, that's the driving force behind everything. They want the kids playing, they want the kids competing, they want the kids doing everything because that's how people make money. And, you know, just sitting in my clinic and listening, sitting in my clinic and listening to these kids, there's a lot of issues with disappointing parents. So as you know, your kids, they want to make you proud. You know, they want you to be proud of them. And a lot of times they kind of go along with lots of things because they know we like it and it brings us joy. But sometimes it's not always what they want. Having issues with peers, their sports dreams, if they get hurt, that's like another big thing. Kids tear their ACLs. They come to the office and the first thing is like, oh my God, am I ever going to play again? And they're like 13, you know, and luckily we have good surgical techniques to be able to get them back to where they need to be. But these are things that they think about. And sometimes if they don't like the sport, they may view it as a big waste of time, you know, and there's a lot of issues where their own values and what they want to do doesn't align with what mom and dad want to do or what their friends want them to do or what they think they should be doing. And, you know, when we look at the flip side of the challenges, the benefits of playing in sports, obviously, you know, they're meeting other people and they have a lot of camaraderie. They're learning trust and friendship amongst a lot of other people because they spend a lot of time together. And a lot of them, you know, they have mutual interests and goals and they want to be a part of something, right? Obviously, being a part of a team feels good. And feeling like you belong to something in that community and pride. I don't know if you spend a lot of time with your kids at the weekend long tournaments and all the parents are there and the kids are there and you're all outside. I mean, it feels good, right? It does have a lot of benefits. And it's definitely something that we need to kind of focus on. And obviously, there's a lot of mental, emotional, and social well-being benefits to all of this. There's physical stuff like increasing endorphins, obviously stress hormones and things, but also like building self-esteem, self-confidence, self-worth. It also can reduce issues with anxiety and depression. The likelihood of teen substance abuse and other risky behaviors does go down because they're always playing their sport, right? They're not out in the street getting into trouble doing other stuff. And it definitely can create opportunities for kind of long-lasting, healthy relationships and friendships, as well as positive social skills and communication. And when you think of the strict benefits of physical activities, it does help with obesity, obviously, and issues with heart disease. It can maintain healthy bones and muscles, good cognitive performance, and better grades. And it's also been linked to better sleep because they get a lot of that aggression and stuff out just by getting it all out on the athletic field. This concept of long-term athletic development is something that I've always kind of harped on. So it's not really about playing in the particular phase of your life, but it's thinking of your life as a long continuum of when you're going to be athletic. And it starts when you're young in the elementary school ages where you're just starting off, then you're learning the fundamentals, then you're learning to train, then you're training to train, then you're training to compete, and you're training to win. So it's like kind of different phases that you want the kids to think about. And, you know, if you come in and you have an injury when you're 14 and you have to miss a whole year because you tore your ACL or you had shoulder surgery or something, it's hard to explain it to the child and their family, but it's actually, if you look at it this way, it's not the end of the world, right? This is just a long journey. If you're in your regular life and something happened, you had an illness, a death of a family member, or some issue, your life isn't over, right? This is just one part of your life moving along. For some reason, athletes and their parents don't always understand that, and we tried to kind of harp on that. But it's my job to try to move people along this continuum as opposed to just really focusing on them playing and winning all of the time. And this is kind of something very similar. It's just a lot of stats about how active kids do better in life, and it's just like this long cycle from early childhood through adolescence to adulthood and all the different things that come along with that. So one of the things we also talk about, and again, as an orthopedic surgeon, I don't get formally trained in this, but how can you be your child's advocate, right? So your child, again, is going along this journey where they're being an athlete, and really open communication and checking in with them is like the biggest thing. And looking at different changes like in their mood and their personality, eating habits, suddenly being isolated or like avoiding different things. And you want to make sure they have not just a strong rapport with their teammates, but also with their coaches as well. Again, being your child's advocate is one thing that parents aren't always the best at, is being open-minded about their child's concerns and thoughts and being an active listener. A lot of times, specifically for some of the parents who are a little bit more overbearing and helicopterish, they come at the kids in such a way to just make sure that they're performing and competing and playing. And if the child may be trying to tell you something that they're not comfortable saying or they don't know how to say it, but a lot of times it's like the way that you respond that'll dictate how much they tell you. And I have kids at home, and sometimes you're a little agitated and they ask you something like, well, what do you mean? And then they just clam up because they are afraid you're going to be mad or this or that. So we have to be very cognizant about that. And, we want the child to feel empowered to make decisions on their own, even if they're really young. If they don't feel like going to practice one day, like, so what? Like, let them take a break, let them take a rest. And then looking at each situation and addressing it accordingly. So obviously every day, as a parent, every day is very interesting, and it's fraught with all sorts of surprises and issues. And sometimes we try to put things in a pattern, but every day for the child is always different. Even though they responded well to something today, they may not respond well to that technique tomorrow. And knowing that as the adults and the parents really is going to be helpful for the child. So thinking about resilience, just like in regular life, athletes go through trials and tribulations. They have injuries, they lose, they get cut from teams, they have coaches that yell at them. They have all sorts of things that happen. And we do want to encourage our children, not just for sports, but also in life in general, to be able to have kind of some reservoir of resources and coping mechanisms and coping skills that they can tap into to try to help them deal with kind of the adversity that may come along the way. And that's what this idea of resiliency can mean. And if you don't really have that, that's where we have issues with the increased stress and the different mental health challenges and unhealthy coping mechanisms, right? Everybody is going to face adversity from time to time, but having appropriate outlets and ways to cope with that is going to be great. So if you maybe work out, maybe you draw, maybe you write in your diary, or like whatever it is, those are going to be the more positive things. But as as a parent, there's some not so positive things that people and children do to cope. And again, this is how do we necessarily do that? So fostering those positive relationships, teaching the kids how to deal with and appropriately acknowledge their own feelings. One of the big things, especially younger kids, they feel things, but they don't know how to deal with it. They don't know how to express themselves. And that can be very frustrating for parents, right? Because when you have young kids and they get upset or mad, what do? They just start crying, right? And you're like, what's wrong? Nothing. And they're crying and they're jumping around. And one of my kids still does that. And he's 9 years old. And I'm like, but I mean, he doesn't know. Like, he just knows he feels terrible. So you have to like work with them on that. And that's like general life skills, but it definitely plays a role in sports, right? Sometimes you take your kid to a certain sport every single day, and one day you take them to practice and they won't get out of the car. Or you take them to practice and they're upset and they're crying and they're this or they're that. And like, you do it every day. Like, why are you upset now? But figuring out how to really create an environment where the kids can open up and talk about it, but also you can give them the skills that they need to deal with that adversity can be very helpful. So just a couple more slides and that should be it. So these are just some of the big takeaways that we kind of harp on. So a lot of the kids that are dropping out of organized sports is really because they don't think it's fun anymore and because it's too stressful. And the reason that a kid won't think running around and sweating and playing games is fun is usually because of the importance of that game that the adults put onto it. If you ask a kid to go in the backyard and run around and play, they'll probably do it any day of their lives. But when it's intertwined and incorporated with all of the other stuff that youth sports has, usually the pressure from us, that's when it becomes too stressful. And again, you always want to think about, like, why are your kids doing it? When you were a kid, when you were 6 years old, like, why did you go outside and play? It wasn't always just to win. It was because it was just something to do. It was fun. It brought you joy. And, as parents, if we can show that we are going to be in a good mood and have a good time, win or lose, then the kids are likely to feel that way as well. And controlling your emotions at games, you've seen these parents who are fighting and yelling and they're insulting the referee and throwing things at the umpire and all this stuff. Well, guess what? All of the kids who are playing in that game where the parents are acting like that, they see all of that. They're not blind, they're not deaf. They can see all of that. And over time, that kind of weighs on them. And again, if you are stressed, worried, or anxious, that's fine. Just try your best to hide it from your child because they're going to pick up on it instantly and it's going to make them feel that way as well. Um, and again, it's not necessarily the results that matter. It's just the development. It's this moving along that long-term athletic development, that long continuum of them growing and becoming, young kids into older kids into young adults. This is a thing, like, try not to coach your kid. I mean, you've seen so many people as the kids like walking onto the field with their bag and their water and all that, and then the dad or the mom's in their ear talking to them about different plays and I mean, just tell them to go have fun and be like, mommy or daddy loves you and cares about you. We're going to be sitting here watching. And again, after the competition, if you find yourself feeling a certain way, try not to put that onto your child, because that's like a very big thing that we do. And like, oh, I'm going to be my child's advocate and show how angry I am at the coach and go yell at the coach to show my child like how much I care. That's not going to work. And again, it's not necessarily about the results. It's really about just a kid trying, just a kid showing up and having a good time. So I think that's it.